Hi, my name is Kallio Hunnicutt-Ferguson. I'm a clinical psychologist and assistant professor at Emory University's School of Medicine and a prevention specialist with the Emory Center for Maternal Substance Abuse and Child Development. I'm here to talk to you today about maternal marijuana use and its impact on the developing child. Just to begin by briefly acknowledging some of the funding sources for the material presented today, along with a statement that I have no conflicts of interest to report. This webinar will focus on reviewing the definitions of substance use disorders, information about SUDs in women and mothers, and provide information about the rates of marijuana use during pregnancy and the impact of marijuana on the developing child. To begin with some definitions, the majority of the population uses some type of substance, addictive substance, even if it's only caffeine. So we think of substance use problems as occurring on a continuum from mild to severe. The Diagnostic and Statistical Manual for Diagnosing Mental Health Disorders defines a substance use disorder as a cluster of cognitive, behavioral, and psychological symptoms indicating that an individual continues to use a substance despite a significant substance-related problem. This can include repeated successful attempts to cut down on one's substance use, as well as continued use despite its consequences. It's important to look at risky behaviors engaged in while using, such as driving under the influence and necessary for a diagnosis of a substance use disorder, impairment of one's functioning because of the substance use. Though substance misuse and addiction are not terms used in the DSM, they are worth briefly reviewing here because they are commonly used. So substance misuse refers to using an illegal substance or using a prescribed substance in a way other than what has been recommended or in ways that impact one's functioning. Addiction was eliminated from the DSM because of its uncertain definition and its potential negative connotations. So this is in an effort to reduce the stigma associated with substance use disorders. However, when the term addiction is used, it usually refers to the more severe end of the spectrum of substance use disorders, usually substance use disorder with some level of physiological dependence on a substance. This could include someone showing tolerance for a substance or needing more of it to get the same effect, or experiencing withdrawal symptoms in the absence of the substance. Now, when we look at the impact of substance use problems on women's health, research shows that women are harder hit by substance use problems than men. And this has been called the telescoping effect. This is first identified with alcohol use, but has been replicated in the use of other substances, including marijuana. Although women tend to use at lower levels than men, their use escalates more rapidly to a substance use problem or substance use disorder as compared to men, and the physiological effects are more severe. For example, women have higher blood alcohol concentrations with the same amount of alcohol used and experience negative health effects like increased risk of cancer, particularly breast cancer. They have increased risk of fertility issues, greater risk of liver disease and heart damage, and increased risk of mortality. Women may also be less likely to seek treatment as compared to men for a variety of reasons, which include stigma, competing childcare responsibilities, as well as lack of representation of women in treatment facilities. So marijuana use is really on the rise among all adult age groups, including in pregnant women, particularly in the context of its increased legalization and decriminalization in some states. This map depicts its legality by US jurisdiction, and as indicated by the red Ds as well as the blue states, we see states where it has been legalized as well as decriminalized. In addition to more widespread use of marijuana, THC, or the mind-altering chemical in marijuana, has changed concentration substantially, with levels in today's marijuana of about 3 times the concentration of the marijuana of 25 years ago. So not only are more people using it and more often, but they are also using more potent forms of it. And despite perceptions that it is not as strong as or dangerous compared to other substances, 1 in 10 people who use it can become addicted. And even more, this rate is even higher if used before the age of 18. There are also a wider variety of products, and some forms of cannabis products like Delta 8 is now available and legal available even in gas stations or over the counter. And importantly, Delta 8 has psychoactive and impairing effects, just like Delta 9, or what's more traditionally known as THC in marijuana, and is also less regulated and can therefore have unique dangers. There are also, as many of us know, a wider variety of forms of ingestion of marijuana that now include more accessible forms like those eaten in food. This diagram depicts illicit drug use in the past year among women aged 12 and older. And when we look at marijuana use in particular, we see that marijuana is the most commonly used illicit substance among all age groups in women. And in the 18 to 25 age group, we're seeing rates of about 30 up to 30% in the past year. Now, when we look at studies that compare marijuana use in pregnant women, in particular compared to not pregnant women, we see about half the rate of marijuana use in pregnant women. So the good news is we are seeing reductions in use when women are pregnant. However, we are seeing that about 8% of women do continue to use marijuana during pregnancy. So when we look at the effects of marijuana on the developing child, on the fetus and newborn, we don't see necessarily any clinically significant short-term effects. So there have been no birth defects and no growth retardation seen in newborns. However, when we're looking at the longer-term effects of marijuana use, we are seeing some impact on certain neuropsychological domains. And this has led some to suggest that a condition exists called fetal cannabis syndrome disorder. Some of the associations that have been found in various research studies include effects on children's sleep, cognitive function like memory, emotional functioning, and worsened executive functions. Some caution is warranted in the interpretation of some of these results. A recent review by Sharapova and colleagues found variable results between prenatal marijuana exposure and children's outcomes. Some of the associations that have been found may be influenced by other confounding factors like other drug use, as well as socioeconomic status. So many of the women in these studies, in addition to marijuana, were using other substances like alcohol, cigarettes, or other illicit drugs. So it is very hard to separate out the unique effects of marijuana on children's development. There are things, importantly, that we can do for children that are affected by maternal marijuana use. First of all, we need to ask about maternal substance use during pregnancy and during child rearing. We need to screen infants and children for the effects of prenatal exposure and postnatal neglect and abuse, because this is more common in children of parents who are using substances. We need to refer children for further evaluation if there are signs or symptoms of concern, and support caregivers in getting children evaluated and in obtaining recommended services. We need to be informed about available resources And no one can do this work alone, so we need to work effectively with community organizations like Babies Can't Wait, school systems, and other providers. In conclusion, maternal marijuana use may have lasting impact on the developing child. Its risk factors, causes, and treatments are complex and requires treating women and affected children with compassion and reducing stigma related to maternal substance use. Interventions do exist to help affected children and to help mothers who are struggling with substance use disorders, but either way, it is best to intervene early. Thank you so much for listening today. We would love to connect. I've listed our email address and website here, and you are welcome and encouraged to leave us feedback. There is a QR code listed here or a link to a survey. Thank you again.